Expect no one to save you. You need to save yourself. Expect no one to save you. When it comes to your health, you need to save yourself. I'm Dr. O, and welcome to Angelic Lift. I want to talk to you about not relying on any, and I mean any, healthcare provider, any expert, any doctor, nurse, physician, provider, whatever the title, to save your health. You in God are the only ones that can save you. Especially looking at how healthcare in the US is nowadays, right? Most doctors do their best in the limited time that they have to care for you, to listen to what you're coming to them for, to do the best they can do in that short amount of time that they have with you. But who is with you 24/7? It's you and your God, okay? And you have to understand that you need to really dig in and not rely on anyone, to pay attention to what's going on in your body, to look at, am I putting in the right nutrients in this temple? Am I doing the right thing for this body? Am I relying on other people that have so much on their plate to try to take care of me? Okay, because too many patients fall into this trap. I have had consultations with patients that come to me and they're so excited to share with me this record of all the specialists that they've seen to try to figure out what's going on with them. And I sometimes stop and say, what are you chasing? Are you chasing a diagnosis or are you trying to get better? Because I am not going to be the 74th doctor that you are going to see to get better. Because at the end of the day, you are going to realize that this decision to get well actually already lies within you. Okay? The human body was designed to heal itself. Believe it or not, everything we need to heal is already in here. There is a mind-body connection. There is chemical messengers that has been designed to go from our brain to talk to our tissues. And there's hormones that our body makes to go from our tissue back to our brain for feedback or letting the body know what's going on. There's immune system already in multiple places, in our gut, in our lungs, under our skin, already there, making sure the outside world doesn't attack us. And if it does attack us, then we have antibodies that we can make to fight back. We have all these things already in us. But why is our body not able to heal itself? Because we are not listening. We are so busy with things, with listening to other people, that we're not paying attention to that same body that is trying to give us signals on, I need help here. So I'm going to use this example of a menopausal woman that all of a sudden you start having night sweats. You start having hot flashes. And rather than stop and go, what are these signals telling me? You run to that provider, tell them you're having these symptoms, and what do they hand you? Immediately give you something for sleep, the ambience of the world. They give you something for anxiety. They give you something for depression. Why? Because those drugs can now mimic, or not mimic, but they can now suppress or band-aid those signals that your body is using to tell you what's wrong. So now you're not having the hot flash because the Zoloft is now blocking it, but is the signal that your body internally was trying to tell you, is that problem still there? You better believe it. Because what is the hot flash that you were feeling? That was your body, your own ovaries, telling your brain, hey, I'm not able to make enough estrogen anymore. Can you let Susie know? And then your brain goes ahead and releases another hormone to let you know, Susie, that there's not enough estrogen being made. And that is what we call a vasomotor signal, which is a hot flash that you felt. So that should be telling, I need to do something to bring my estrogen level up. Not band-aid it with Zoloft, okay? What about the night sweat? What was the signal there? Well, that was your ovary letting your brain know, I don't have enough testosterone anymore. Yes, I said testosterone. Yeah, and I'm talking about Susie, a female. Yes, women have testosterone. Just like men, we just have a smaller ratio, but we have it. And guess what? It's very important. It's very important for sleep. It's very important for us not to have those night sweats. It's very important for us to not have belly fat. It helps us have mental focus. It helps our libido. So if your wife keeps saying she's not interested, that testosterone might be low. Okay? So those are some examples of what testosterone is going to be helpful for in a woman. But when she's having those night sweats, where she's taking the sheet on and putting it back on because she's hot and then she's cold and then she's doing that all night, which is disrupting her sleep, which is why the doctor wants to give her Ambien. She doesn't need Ambien. She needs testosterone so that she can get that hot flash, that night sweat to stop so she can sleep again. Okay, so that's what she needs. She doesn't need the anti-anxiety medication. She's not going crazy. Those signals are real. So she needs those hormones back. And what your body is asking for is those hormones. It wants those hormones. It doesn't need those 3 medications that was just thrown at you, because that doesn't fix the underlying issue. Okay? Same thing. You start having migraine headaches all of a sudden. Well, guess what? Maybe your progesterone level got too low. So I see a lot of patients coming in with migraines of 17 years, and I'm going, yep, that's about right. Because you went through the advanced maternal age at age 35. Now, 17 years later, yes, your progesterone is all dwindled. So you're now having trouble sleeping, you're having migraine headaches all the time. They're giving you sumatriptan and, Imitrex and all these drugs that are just band-aids. They're not fixing the underlying progesterone deficiency. Okay? So your body knows what it needs to heal, and it's giving you the signals so that you can replace those things that are missing, so it can do what it needs to do. Giving it band-aid drugs is not the solution. Okay? So that's an example of not relying on others to save you. You have to listen to these signals and really research, what do these signals mean? Not what the doctor can use to band-aid them, what they really mean. What does that high blood pressure really mean? What is this high cholesterol? What does it really mean? It's not asking for a statin drug. That high blood pressure is not asking for lisinopril. It's a signal. It's something telling your body something is going wrong. The heart is pumping against the pressure that's too high. Well, why is the pressure too high? Let's talk about that. Let's deal with that. Okay? And not just band-aid everything with medication, and we just a walking pharmacy. We have 10, 20 prescriptions that we have to take in the morning before we even step out the house. Okay, that's not the goal. So your body knows how to heal. You have to save it by listening to the signal it's giving you, figuring out what that signal really is, and then fixing that. Not relying on just bunch of experts throwing medications at you for you to just start swallowing every day with no end in sight. And let's not even talk about the side effect of all those meds, because now those meds have their side effect. Let's just take the cholesterol one for example. Right now we've got muscle aches and pain from using the cholesterol lowering medication. Right? Then we want to take something for that. And then that thing that we took for that now has its own side effect. And we just go on and on and on. Okay? The body knows how to heal. We just need to find what it's telling us. I need you to comment on this one. I want to know what you guys think. What questions do you have for me about this topic? And let's talk about it.